questions because she's a doctor. You're a doctor, right?
You're a Doctor, Right? Take 4. Hi, everyone, and welcome back to You're a Doctor, Right? The podcast that answers all of your most common medical questions. I'm Dr. Sonya Bhole, and I'm a board-certified radiologist, and I'm back today with Dr. Courtney Weems, who's a board-certified pediatrician. Thank you so much for being here again.
We're excited to be here.
We seem to have terrible luck because the first time and this time we've had tons of technical errors, but it seems like we're recording again, take 4. So let's see if this goes through. Fingers crossed.
Sounds good.
So our first episode with Courtney, we talked about all your questions related to babies. So scoop on poop, feeding, sleeping, vaccinations, including the measles vaccination. It was an incredible episode. So if you haven't listened, make sure you go check it out. This time we're hoping to get to kind of the older child. They say bigger children, bigger problems, right?
Yeah.
So adolescents, fevers, mental health,
All the
we're going
big
to cover
things.
it all. But first, I kind of want to start with spring break.
Okay.
Before we get started on our episode today, I want to remind all listeners that the content of this podcast is for informational purposes only and does not constitute formal medical advice. Do not delay in seeking professional medical care because of something that you have heard in this podcast. If you have any questions regarding your own health, please talk personally to a doctor or other healthcare professionals. Relying solely on the information provided in this podcast should be done so at your own risk. Now that we're done with the paperwork, let's get started on this episode today. So we had some questions we had talked about, but I'm actually going to change them a little bit because this is spring break week. Spring's in the air in Chicago. It's 69 degrees outside.
Yes.
We all just got back. But there's so many things that happened during spring break that I was like, gosh, I wish Courtney was here so I could ask her. So I'm going to pivot a little bit, but I first kind of want to start with fever. So we were in an island off the coast of Florida that you had to get there only by ferry. I usually take this giant bag of all this stuff, right?
Smart.
But I didn't want to take it all. So I just threw ibuprofen and Band-Aids in a bag and called it a day. And of course we get to this island and day 4, Asher has a fever. So the only way I know he has a fever, I never take a thermometer, is that I just kind of knew, you know, and I was always taught to treat the child, not the fever. I guess, is that correct? Should I be checking the temperature?
No.
What is your advice on that when parents ask?
My advice is to always treat the child like you just said.
Okay.
If you can usually tell when they have a fever, they're like laying around, they're, not eating, not drinking, they're just feeling bad, and you can just sort of tell. There's not a number I'm actually scared of, so I don't need to know the number. I would just treat the child like you did. And they actually, there's studies that show that moms can actually tell when a child has a fever without a thermometer. So yeah, it's actually evidence-based.
Okay.
So,
I need my husband to listen to this episode because I always say that I can always tell when our kids have a fever. I actually put my forehead to their head and I can tell, not even my hand.
It's evidence.
So it's backed by evidence. Okay. Of course, when I get there, he has a fever and I gave him ibuprofen. It wasn't touching it. I usually alternate the ibuprofen and Tylenol. One store in the entire island, I'm like, there's no way this store is going to have children's Tylenol. It did, and chewable. So I was able to alternate it and it could control his fever.
Yeah.
Is that what you recommend, the alternation
I think
of the two?
Yeah, I think if they're feeling badly, alternating them every 3 hours. So Tylenol, then Motrin, then Tylenol. Then you can't give one too much, because you don't want to give Tylenol more than 4 times in one day. So that gives you a little bit of coverage. So that way they're like still eating and drinking and feeling a little bit better. And then I also tell parents, throw them in a lukewarm bath. It does, it releases more heat and it helps them. Okay. So it makes them feel better too.
What about a washcloth on their head?
Yeah.
I was doing that, but then Asher was like, this is so uncomfortable. I'm like, I think I saw this in a movie once. I mean, is that okay?
It does, yeah.
Okay.
Yeah. And the same thing with the back of the neck.
Okay.
So places where they lose heat. So top of the head, back of the neck, feet, hands. Good places to, put, a washcloth or, an ice pack or something like that.
Okay. Really helpful. So as you know, the premise of this whole podcast are questions we get during social places, right? Like cocktail parties or hanging out, vacation.
Totally.
So a big topic of our family was, okay, a lot of us brought little tiny bags. What are the essential items we should be putting in these bags, especially if you're going out of the country or going to an island like we did that you might not have a Walgreens down the street.
Right.
And I kind of came up with something, but I want to run it by someone who's actually certified to talk about this, not a radiologist. So I came up with the 3-2-1.
Okay.
So 3 liquids, ibuprofen, Tylenol, Benadryl.
Love. Okay.
Okay. 2 creams, Neosporin and hydrocortisone.
Oh, love. Yes.
And Band-Aids.
Oh, yeah. I
Anything
love it.
else
I think
you would
that's
add? that?
Yeah, I think that's perfect. Really, that's all you need.
Okay.
Unless there's some medication that they're prescribed, of course, because then you would obviously not want to leave without your EpiPen. You want to have that with you at all times. But yeah, I love that pick. The only other thing that you could ask for, just simply because this always happens when people go on vacation, is some sort of stomach thing happens and people start throwing up, and then everyone's throwing up. Zofran is great to bring with you. It's the same dose for kids as it is
Obviously
for adults.
prescribed by your doctor.
Yes,
There's no sort of over-the-counter type of Zofran. Okay.
Yeah, no. I mean, there's over-the-counter Dramamine, which can help with nausea, but I give it to my patients all the time.
Okay.
Just to bring with them. You can't get it in lots of other countries. Okay. So it's a really good one to take with you. Okay. So ask your doctor for that.
Really helpful. The other thing I was thinking of that I usually take with me, it's so stupid. It's like from Amazon. It's like a trauma kit, right? So it's
nice.
Band-Aids, or bandages, the scissors.
Yes,
I mean, are there any other, if we are just doing 3, 2, 1, are there any other vacation tricks? Like what if someone splits their head open?
Oh yeah.
Or what if and you only have tiny Band-Aids?
There actually is. So if you split your head open, like in the actual hair line, anywhere in on the scalp, you can take little pieces of the hair on each side of the laceration and braid them and then knot them. So that way, so you actually like physically knot them. You pull it together and you just do it all the way down the laceration. Okay. And it will heal. It does a really good job. Now the hair is going to be messed up, but whatever. It's better than trying to get to the, get staples put in at the ER. That's 5 hours away.
5 hours away. Okay. That's really good to know. That's really, really helpful. Yeah. Okay. And I really wish I'd thrown more into my bag, but at least now we kind of came up with the system.
Yeah. And Steri-Strips is actually another one that you could bring with you. Cause like if you had a cut or something on the face and you couldn't get to the ER, you could certainly just like pull the laceration together, make it taut, like really like nice and re-approximate. And then that would heal well too.
Okay. So 3, 2, 1, 1.
Yeah.
3 liquids, 2 creams, Band-Aids, and Steri-Strips.
Love
it.
Should
Have it covered.
Love it.
Okay. And then Zofran, if you want to ask your pediatrician or your family medicine doctor.
Yes.
Okay. Second story that happened on spring break, because it's just like always something, right? Of course, we're waiting for this ferry. We flew in, we drove an hour waiting for the ferry. We had 15 minutes to wait for a ferry. And in those 15 minutes, Christian, my 4-year-old, shoved a seashell up his nose. Thank God my husband saw him do that immediately and was able, it actually took him a few seconds. I was like, oh God, we're going to have to, but he was actually able to get it out with his finger. My gosh. But cut to a few months ago over the holidays, of course, it's like 8 o'clock. 50 family members in our house, 5:30 a.m. Sprinter van coming for like a ski trip, and everyone's going to bed, and Scarlett comes downstairs. Her nose is bleeding a little, and she's like, Mom, I stuck something up my nose. I'm like, what is it? And she's like, I don't know. Okay, so of course we did that. So then we go to the ER. It's an 8 to 9 hour wait. We're like, we can't do this. We're going to be on a flight by then. Yeah. So we called our pediatric ER friend, who basically told us to go to Walgreens, spray some Afrin, and blow again. Yeah. And it came out. It was a peanut. And it came out, it was literally the single most, to this date, like satisfying moment of my medical career was seeing a peanut in the Kleenex, but we got it out. So what are your thoughts of that? What? Sticking things in orifices, noses, ears.
I don't know why kids do this. I don't know why they do it, but they put it anywhere they can. Nose, ears. It's just something like stimulatory for them. They just enjoy it, especially like when they're napping, like about to go down for a nap, or anytime you leave them alone. They're just constantly trying to figure out something to do. Yeah. And so they do that a lot. There is a technique that's pretty easy to do, which is the mother's kiss. I know we had talked about that.
Well, actually, I have something to tell you. So I'm so intrigued on this. I was hoping you would touch on this. I put a prop under your chair.
Okay.
Do you think you can demonstrate? Because our friend did talk about it, and I was a little too scared to try it. Okay. So can you tell us what a mother's kiss is?
All right. So if there is a peanut stuck on, let's say, the right side of the nose, you're going to apply pressure onto the left to collapse it. So you're going to collapse the nose, and then you're going to blow as kind of forcefully as you can. So, and then it will pop out.
Oh, okay.
Yeah.
Okay.
It's hard if it's really stuck. Okay. But if you blow hard enough, it'll come out.
And does the Afrin trick also work?
Yeah.
Do you do Afrin before you do that?
No, you don't need to. But if you have Afrin, you could always use it.
Okay.
But that's just basically you're just trying to get more kind of room around the object. So if you just spray up the Afrin around the nose, then it sort of what's the word? Like the swelling goes down, and so then the object comes out. Yeah.
Okay.
And then you could do the mother's kiss.
Good to know. I even did her hair for this.
Well, thank you for
thank you.
Thank you.
Cute little high pony for this. Okay. All right. That was really, really helpful. But of course that always happens. And you're like, oh my gosh, what about ears? We have not yet had this, but I know it's coming. So what do I do?
Ears are really tough.
Seashell in the ear?
Oh my gosh, it's so tough. So what I would say is if you have like something that can apply pressure, like, you know how when you get Tylenol,
yes.
and they give you that syringe,
yes.
if you can use that syringe, so fill it with water and then just shoot it into the ear as hard as you can.
Okay.
A lot of times it needs more than just like that syringe. So if you have a bigger one, or you can get to the pharmacy and get a bigger syringe.
Does it need to be sterile water? Or can
it can be any kind of water because I mean, technically I would, if I had my way, I would use sterile water. Yes. But if you're in the middle of nowhere, just use tap water.
Tap water.
So you'll just kind of pull it up and then shoot it into the ear and like try and get it to kind of dislodge.
Okay.
But if it stays in there and is not coming out, you got to go to the ER or see your doctor.
Okay. Good advice. Okay. So hopefully we won't have that, but if so, we know to shoot that water in the ear and get that out.
That's right.
Or go to the ER.
Yep.
Okay. A lot of iPad time.
Yeah.
Still feeling guilty about it. On the plane, in the car, all the time.
Always.
What are the latest recommendations on iPad time?
Well, it's kind of age specific.
Okay.
But really every kid should be less than 2 hours of screen time per day. And that's even like the older kids.
Okay.
So the Surgeon General just recently published their advisory on screen time and social media. Yes. And so they said that kids, adolescents age 13 to 17, if they are on social media for more than 3 hours a day, they are double as likely, so twice as likely to develop anxiety, depression, other mental health disorders.
Okay.
So we really want to limit screen time and social media time.
Okay.
And then obviously for the younger kids, just do the best you can. I always tell that to my patients. Like sometimes you're going to have to put them on.
I mean, full disclosure, the only way we're able to do this is my kids are on iPads upstairs.
Right, exactly. My kids are on iPad.
Right.
Somebody
We got to do it. Right.
Yes, exactly.
But
there's
but
times
limiting to try to limit under 2 hours.
Exactly.
I was actually so glad you touched on the Surgeon General warning because I was thinking about this and. When it comes to adolescents, what are the ages? Like all these wait for 8 petitions going on for cell phones. Yes. What are the ages for that?
Yeah. I mean, I think the 8th grade is a great, if you can hold them off for these, smartphones until 8th grade, that's the best thing to do. And then flip phones obviously are a great option if you're going to give them a phone. Okay. Because then you can communicate together. And then there are smart watches, where you can call them and track them. So that's what we do with our kids. We have a 9-year-old and a 7-year-old, and he has what do they call it? Apple Watch. Yeah. And I just track him on that. I can call him on that. Yeah. That way he can't get on the internet. It's too hard. Yeah. So, and then he's not playing video games, but then, so if you wait till 8th, do the flip phone. Okay. And then if you can, the longer you can hold off on social media, the better. Yeah. I mean, that's just the answer. Your family has to figure out when it's going to be appropriate, but know that there is going to be a backlash from it, and that's the problem. But it's hard because they want to be on it because their friends are on it, but then they're inevitably going to have problems because of it. They're going to feel left out. They're going to feel pressure about their body. They're going to have, weird and incorrect ideas about what things are supposed to be and look like. Yeah. So having those really difficult conversations about what a real life looks like and what real emotions are and what real bodies look like. You have to go through the nitty gritty and really make sure that they understand that. And, they're still developing. 26 is when their prefrontal cortex is completely
26.
Yeah. So until then they have no true concept of what is right, what is wrong, what is true, what is not true. Yeah. So the best that we can do is just really drive it home.
I mean, I feel like that with me and social media. I'll get on it and it'll be a great day and I go down this rabbit hole and then all of a sudden I feel anxious and sad afterwards.
Me too.
You're looking at everyone else's life and you're like, I know. Why is my life X, Y, and Z? Why am I not there?
So why am I not up-risky?
Right, exactly. Yeah, I know. Even me as a 40-something-year-old woman, when I get on social media, I get anxious and depressed, so I can only see how kids, especially before the age of 26, feel the same way.
Exactly. It's true.
So I think what you're talking about with these real conversations are so, so important,
It really is. It just needs to be a constant part of your daily, life, just having these really difficult conversations.
Yeah. Bigger kids, bigger problems, we said at the beginning. Right. Okay, so let me summarize everything we've said so far. So number one, with kids' fevers, you're traveling, remember 3, 2, 1, 1.
Yep.
A Tylenol, Benadryl, ibuprofen, some sort of hydrocortisone cream, Neosporin, Band-Aids, and Steri-Straps.
Yep.
Treat the child, not the fever.
Exactly.
If the kid's fever isn't coming down, and mom knows, they know, the studies show, they can tell. If you have a thermometer, great. But if you don't have a thermometer, if your instinct is saying that your child has a fever and they kind of are feeling lethargic or tired, treat it.
Yep.
Ibuprofen, Tylenol, you can add in the Tylenol if you need to, but no more than 4 times a day.
Right.
So you can alternate those. Sticking things up your noses. You can try to have the kid blow it out. You can try Afrin. You can try the mother's kiss that you demonstrated. In the ears, shooting water into the ears with a syringe. If it doesn't come out, go to emergency room or talk to your pediatrician. And then adolescents, mental health is real. Try and hold off as long as you can with the cell phones and social media. Have real conversations with your kid. But there really isn't an exact age. It's really what's good for your family.
Exactly.
And just make sure you're checking in.
Yep, exactly.
Thank you so much, Courtney. This is so full of information. And I just appreciate your time so much.
Of course.
Okay.
So fun.
Thanks.